Okay, I'm gonna start scanning my room. My patient. The door is closed. These are my tools. I'm gonna do the same with the mirror. Okay, I'm gonna sanitize my hands. I close the door for my patient's privacy. Hi, my name is Shahnoza. I'm a nurse practitioner. I'm gonna be doing the exam of your head, eyes, ears, nose, mouth, throat, and neck, okay? So, I reviewed your vital signs obtained by the nurse, and your temperature is 97.2, your blood pressure is 124/85, your pulse is 82, your respiration is 40, and your oxygen saturation is 99. Your height is 5'9", and your weight is 190, which gives us a BMI of 28. Could you please tell me what brought you in today?
I have a sore throat and difficulty to swallow.
When did it start?
2 days ago.
Okay, could you please tell me what does it feel like?
It's difficult to swallow and I have a irritation in my throat.
Is there anything what makes it better?
Yes, when I drink hot tea, suck on mint candies or take a hot shower.
Is there anything what makes it worse?
Yes, when I breathe cold air or when I swallow.
Okay, and do you have a cough as well?
Yes, I do. It started today in the morning.
Okay, I will be looking at this today. So I'm going to start with inspecting your skin, okay? So I can see that my patient's skin is pink in color. It's uniform throughout. I'm looking to any evidence of edema, trauma, or any lesions. And if I do see any lesion, I would like to know the location, the size of it, and I want to know how bad is the wound that looks like, and the skin surrounding the wound. During the exam, I'm gonna check the skin from head to toe. Now I'm gonna check for the skin turgor. Give me a hand. I'm gonna check it on the back of the hand. I can see that his skin is elastic. Patient's skin looks good. No any evidence of pallor, cyanosis, or jaundice. Now I'm gonna palpate the skin. The skin is dry and warm. The texture is smooth. I also will check the hands again. The color is uniform. It's pink, dry. The fingernails are well maintained. The nail bends are pink. Also, I'm gonna check in here the capillary refill, and I can see the color returns to pink quickly, which shows me that he has a good perfusion. I'm also checking the nail bends, and they are above the 160 degrees. I don't see any evidence of clubbing. Findings are symmetric. Now I'm gonna palpate the scalp. Any tenderness?
No.
Okay, good. The scalp is feels full formed. The scalp is symmetrical. I don't feel any bumps. So I'm looking at the condition of the scalp, and I can see that the scalp is white, and the hair is full and evenly distributed. The hair is well maintained. No evidence of dryness, dandruff, or alopecia. Thank you. Now I'm going to assess the face. And looking at the face, at the structure of the face, I'm going to look at the eyes first. And I can see that the structure of the face are symmetrical. The outer contours of the eyes lining up symmetrically to the upper part of the ear. The nasal labial folds are symmetrical, as are the corners of the mouth. Now I'm gonna assess the cranial nerve number 7. I'm gonna ask my patient to smile for me. Thank you. Raise your eyebrows. Good. Puff up your cheeks. Good. Frown. Close your eyes. Show me your teeth. Good. The cranial nerve is intact. The symmetry is noted. Now I'm gonna palpate the temporal region. Any discomfort?
No.
Okay, good. I feel +2 pulse on the temporal region bilaterally. Now I'm gonna okay. I do not feel any coding, and patient denies any discomfort or pain. Now I'm palpating the frontal sinuses and the maxillary. Any discomfort?
No.
And the percuss. Any discomfort?
No.
Okay, good. Now I'm gonna assessing the cranial nerve number 5 for motor aspect. For that I'm gonna ask my patient to clench your jaw. I'm feeling for the muscle and I'm feeling the symmetric findings. Okay, now I'm gonna assess the sensory component on the cranial nerve number 5, and I'm gonna ask my patient to close his eyes. You're gonna tell me in which part of your face you're feeling when I'm touching it, okay? Okay.
Left eye.
Okay.
Right cheek.
Okay.
Left jaw.
Okay, good. The sensory company of the cranial nerve number 5 is intact. My patient was able correctly to identify the ophthalmic, the maxillary and mandibular region. Now I'm gonna examine the lymph node. I'm gonna palpate the lymph nodes using a circular motion to feel if I will feel any enlarged nodes. I'm gonna start from occipital, post-auricular, preauricular, submandibular, submental, anterior cervical, and I'm feeling it's superficial and deep, posterior cervical, supraclavicular. Could you please shrug your shoulder? No evidence of enlarged lymph nodes. Now I'm moving to eyes and looking closer to the eyes. I'm looking at the eyebrows and I see that they are symmetrical with even hair growth. Looking to the eyelashes, upper lid and lower lid. The eyelashes are inverted. I'm seeing symmetry of the left and the right side. I'm gonna take a look to the internal structure. For that, I'm gonna pull the eyes down, and I'm seeing the conjunctiva, which is pink bilaterally, and sclera is white. I'm gonna look from the side. I'm gonna look at the cornea, which is clear, and I don't see any evidence of cloudiness. No arcus, no signs of trauma. So looking on his eyes, I don't see any signs of ptosis, edema, erythema, or trauma. I'm gonna grab my light source and I'm gonna inspect the pupils. Okay. Looking up to the pupils, I'm assessing cranial nerve number 2. Both pupils are equal, size 4. Checking for light reaction. Pupils constrict to about 2 millimeters. So I'm gonna check the consensual response. Can you bring your hand in the bridge of your nose? Okay. So I'm gonna shine to one eye to see the consensual response to other side. Okay. So we have direct light response and consensual response as well. Now I'm gonna check for the red light reflex. I can see red light reflects bilateral. The orange glow fills up the pupils. Now I'm gonna assess the optic fundus. For that, I'm gonna come closer to my patient. I can see the orange optic fundus, and I can see all four quadrants. I can see the arteries and the veins in 2:3 ratio. The arteries are lighter in color and the veins are bright red. I didn't see any evidence of hemorrhage, cotton wools, patches, or nicking. So also, I'm going to check craniometer for the visual acuity. Please. Do you wear eyeglasses or or contacts?
No.
Okay, good. So you're gonna hold this approximately like I do. Good. And you're gonna read the last line.
GEFBOTEC.
Good. Same I'm gonna do closing each eye. And this tells me that he has a vision of 20/20. The next, I'm gonna check him for color blindness. Could you please tell me the numbers?
25, 29.
Correct. I use the Ishihara chart, and so I can see that the cranial nerve 2 is intact. So now I'm gonna assess the cranial nerve number 3. Could you please look at the distance to the wall and just follow my finger and back. Okay, good. The pupils are converge and constrict. The cranial nerve 3 is intact. The next, I'm gonna assess the corneal light reflex. This is called Ishihara test. Oh, Hirschberg test. I'm sorry. So I'm gonna bring the light to the bridge of the nose, and I can see the reflection of the light in both eyes. It is symmetrical, and so I can say that the corneal light reflex and the cranial nerve 5 is intact. The next test I'm gonna do is to inspect the extraocular movement of eyes. I'm testing the cranial nerves number 3, 4, and 6. For this, I'm gonna use an H test. You're gonna follow my hand. Okay, good. So I can see that the eyes moving symmetrically. I don't see any muscle weakness, and I can say that the cranial nerves number 3, 4, and 6 are intact. Now we're gonna do cover and uncover test. Cover one eye, uncover. Now cover another eye, uncover. Good. Eyes are midline and symmetrical, and there is no movement or the deviation of eyes. Okay. Now I'm gonna assess for the visual field or confrontation. For that, I'm gonna also ask you to cover one eye and just tell me what number you see.
3.
Okay, how many fingers you see now?
4.
Okay, I'm gonna do the same on other eye. Now I'm gonna move to ears, and I'm just gonna start inspecting from outside. I can see that the skin is pink, the ears are symmetrical, the skin is in good condition. I'm looking at the external ear first, and I don't see any dryness, I don't see any drainage. Any discomfort?
No.
Okay, good. I'm gonna palpate the mastoid process, tragus, pinna. Any discomfort?
No.
Okay, good. Now I'm gonna inspect the ear canal and eardrum. Oops. 1 second. I'm just gonna put it in. Okay. Alright. The ear canal is pink, and I see some cilia, small amount of cerumen. So I'm gonna pull up and back, checking inside. I can see it flat and clear translucent tympanic membrane, handles of the malleus, and the light reflexes at 5 o'clock. I didn't see any evidence of redness, bulging, or fluid in the ear. So I'll do the same on the other ear. Now I'm gonna do the whisper test to assess your hearing. Okay, can you close one ear, please? And can you repeat after me?
It's a beautiful day.
Good. Cranial nerve number 8 is intact. I'll do the same on other ear. Now I'm gonna perform the Weber test. For this, I'm gonna use my tuning fork. I'm gonna strike my tuning fork, put it in the middle of your forehead, and you're gonna tell me how you're feeling the sound. If it's even, or you're hearing it's louder in one ear than another, okay?
Yeah. It's even.
Good. The next I'm gonna do the RAN test. So again, you're gonna tell me when you stop hearing the buzzing, okay?
Next up.
Now?
I hear it.
Good. This tells me that the ear conduction is louder than the bone conduction, which is a normal finding. So cranial nerve number 8 is intact. Now we're gonna move to the nose. So looking at my patient's nose, I can see that the skin is again intact. I don't see any lesions. The nose is symmetrical. The nasal labial falls symmetrically. So I'm gonna ask you to cover one of your nostrils. Inhale. Now other side. Good. I'm gonna ask you to close your eyes, and I'm gonna ask you to smell and tell me what you smell.
Coffee.
Good. So my patient was able to, thank you. My patient was able to identify the smell of the coffee. This is telling me that his cranial nerve number 1 is intact, and he was able to breathe in and out with both nostrils, which is telling me that both nerves are patent. Okay. Now I'm gonna use my light source to inspect the inside of your nose. Okay. Okay. Tilt your eye. The septum is midline. The turbinates are small and pink, and cilia is present. I didn't see any deviation of the septum, and I didn't see any drainage. I found the same findings in both sides. Alright, now we're gonna move to mouth. Looking to my patient's lips, I can see that lips are pink and moist. I don't see any cyanosis, no dryness, and lips are symmetrical. Could you please show me your teeth? Good. The teeth are in good condition. They're well maintained. No evidence of dental caries. So now, stick your tongue out. Good. The tongue is midline. There is slight white coating. I do see population. Could you please move your tongue to the left, right, left. Okay, good. Close your mouth and push your tongue against my head. there is a good strength, and it's telling me that the cranial nerve number 12 is intact. Now open your mouth. Good. Buckle because it is pink and moist. Teeth in good condition. I can see a septum along the second molar. Tank up. And I can see the worsened duct under the tongue. Okay. Open. Posterior pharynx are pink and moist. Okay, could you please say up? Okay, good. I see the soft and hard palate, and they rise symmetrically when my patient is saying R. Cranial nerves 9 and 10 are intact. Tonsils are at a size 3. No evidence of swelling, exudate, or tonsillar stones. I saw a mild redness on the back of the throat. Okay. So now I'm gonna palpate inside of the cheeks. I'm gonna use my gloves. Okay, good. Stick your tongue out. Okay, good. Out. I don't feel any evidence of lesion along the edge of the tongue or under the tongue. At this point, I can assess the cranial nerve number 10 for the gag reflex, but I'm not gonna perform it. The next, I'm gonna assess your temporomandibular joint. Open, close, open, close, open, close. Okay, good. So I don't feel any crackers. I don't hear any cracking, which tells me that his temporomandibular joint functioning well. The next, I'm gonna move to the neck. So I can see that the color is pink. The neck is symmetrical. I don't see any deviation of trachea. And the hair growth is even. So the trachea is midline. I don't see any tracheal deviation. So I don't see any jugular vein. I don't see any jugular vein distension present when he's sitting upright. That's why I'm gonna ask my patient to lean back a little bit on the 30 degree. Straight up your neck. I see the pulsation, and I'm gonna use my measurement in centimeters. So perpendicular to the angle of Louis, I'm bringing my measurement to the intersection where the pulsation lies at the neck. The measure is about 3 centimeters, and I'm gonna add up about, you can sit up, and I'm gonna add up another 4 centimeters. That is which is the level of the arterial, which will give me the jugular vein pressure about 7. I'm gonna palpate now the cervical spine. Any discomfort?
No.
Okay. I'll palpate paravertebral muscles on each side. Any discomfort?
No.
Good. Now I'm gonna check your trachea. It is midline, no deviation, and I'm gonna check your thyroid. I'm gonna do it behind the patient. Could you please swallow again? Good. I feel that his thyroid is moving up and down when my patient is swallowing. I don't feel any enlargement. I don't feel any nodules. Okay, good. Good. Now I'm gonna palpate for the carotid pulses, one at a time. carotid pulse is +2 bilateral. Also, I'm gonna now auscultate for carotid. Okay. Exhale and hold it. No bruise present in carotid. Now I would like to check the cervical spine for range of motion. Please bend your hand to the front down, back, left, right. Okay, make a circle. Alright, good. He has a full range of motion. The next, could you please push against my hand on the side? Shrug your shoulder. Good. This shows me that the cranial nerve 11 is intact. The next, I'm gonna assess the respiratory function. Could you sit with your back? Good. Could you breathe? Out. Good. When my patient is breathing, I see that his respiration is nice. He's not using accessory muscles to breathe. The respiration is even. And no sign of distress. Now I'm gonna listen to your lungs. Breathe in and out. Again. Again. So when I'm here at the right lateral side position, I'm listening to the right middle lobe. Sit to me. Facing to me. The next I'm gonna listen to the back. I'm gonna do it over the gown for patient modesty, but it's better to do it on the naked. So I'm gonna listen on the second intercostal space for the aortic, slight left pulmonic, third intercostal space, Erb's point, fourth intercostal space for tricuspid, and the fifth mid-clavicular line will be mitral. I'm gonna do the same with the bell of the stethoscope in all 5 areas. When I auscultated for heart, I didn't hear any. I heard the S1 and S2. I didn't hear any murmurs, growls, any gallops, or extra heart sounds. At this point, I'm gonna conclude my assessment of head, eyes, ears, nose, mouth, throat, and neck.